everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with very important MCQs which are helpful for your competitive exam. Who all have visited first time on this channel, please do subscribe and watch. We'll see the first question. The Parkland formula for burn resuscitation calculates the fluid volume to be given in the first how many hours? Options are given. 24 hours. Next question. A patient with a head injury has a dilated and non-reactive pupil. This indicates right option is B, that is increased intracranial pressure on the same side. Next question. The purpose of long rolling a trauma patient is to right answer is B, that is assess the back file maintaining spinal alignment. Next question. In a patient with a severe allergic reaction, there is anaphylaxis. The first line medication is right option is D, that is epinephrine, adrenaline. Next question. A patient with a suspected flail chest where a segment of the rib cage is detached will demonstrate right option is B, that is paradoxical chest wall movement. Next question. The recommended position for a patient in shock is options are given. Supine position with legs elevated. Next question. The primary purpose of a closed wound drainage system is to right option is C, that is remove fluid and blood from a surgical site to prevent hematoma and promote healing. Next question. A cleansing enema is administered to primarily remove feces from the colon. Next question. Which emergency medication is a benzodiazepine used to stop active seizures? Option is B, that is lorazepam. Next question. A chronic chest disease characterized by irreversible airflow limitation and destruction of alveolar walls is right option is C, that is emphysema. Next question. The Ottawa ankle rules are used to determine the need for an X-ray following an ankle injury. Next question. The patient with increased intracranial pressure should be positioned with the head of the bed. Elevated 30 to 45 degrees. Next question. When applying cold packs to a new musculoskeletal injury, the primary goal is to limit inflammation and swelling by causing vasoconstriction. Next question. Naloxone is an emergency medication used to reverse the effects of opioid overdose. Next question. A patient with pleuritic chest pain would best be positioned lying on the unaffected side. Next question. The purpose of a sitch bath is to right option is B, that is cleanse and provide warmth to the perineal and rectal area. Next question. A patient with a confirmed deep vein thrombosis in the left leg should have the limb elevated above the level of the heart. Next question. The primary reason for using warm compresses is to right option is B, that is promote muscle relaxation and increase blood flow. Next question. A patient with an acute asthma attack is likely to be most comfortable in which position? high fowlers or sitting upright, leaning forward. Which of these bandages is used for dressing? Cotton cloth bandage. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.